Hello everyone. So we got chapter 11. We're going to get into the muscles. Again, I feel like this is also like the skeletal system where I'm just going to point out a couple things, but most of the job or most of the learning is going to be on you, trying to memorize different muscles. On the lab activity, we have almost every single muscle um, for you to label. So I think that's going to help you out a little bit. And then the second part of the lab also, it's going to make you think a little bit about the different muscles and different parts of the body with different functions that we do. So I think it's a cool, it's a cool topic. It's kind of like the bones. There's a lot, but it kind of all kind of blends in together as well. So let's see if I can give you some pointers, see some things that can help you memorize a couple things. Maybe sometimes even point out the obvious or where the muscles are, but again, it's going to be more on you trying to look at images, look at different pictures and different labels, all right? So let's do it. So um, muscles are attached in different areas. So we have what's called the origin, the insertion, and the action, okay? So where they're from, where they're attached to, and kind of what they're going to do, okay? Mainly going to talk about skeletal muscles. So they cause movements by exerting force in the tendons that are on the edges that attach the muscle to the bone. So that tendon with that muscle is going to pull that bone to make a certain function, a certain movement. Okay. Articulating bones usually do not move equally or the same in response to that contraction. So as you can see here, we have our arm, our humerus, our scapula, our shoulder. Have a couple of joints in there, shoulder joint, elbow joint, okay, and that muscle in the middle, the biceps or the triceps, they're gonna do a certain motion that's gonna move that tendon, which is attached to either the radius on the bottom or it's attached um, to the scapula on the top. It's gonna make it move somewhere. So that's pretty much the function of the muscles, okay. And there's different types of attachments and movements. Some have more force. So there's some muscles, if you think of bodybuilders, there's some muscles that are bigger and can lift bigger stuff than other muscles. You're not really working out your fingers. You have really small muscles on your fingers, right? People are working out their biceps, their pecs, their chest, their back, their hamstrings, their quads. So you got bigger muscles to lift up much more force. Okay, so those are called lever systems. So there's ways in which we're gonna move different things, and depending on where kind of the point of attachment or kind of where the load is and where the force is gonna be, where the effort is gonna be placed on, how much it's actually gonna move. Okay, so we're just gonna talk a little bit about this. It can be an advantage or it can be a disadvantage depending where it's placed. So there's three types. We got first class, second class, and third class. That was called the fulcrum, the effort, and the load. So it just depends on where it's going to move. So here's a couple images, or an image from the book. We talked about the bicep right here. So kind of the fulcrum is a little point of kind of reference, or that little angle. So we got right here the elbow joint. The load is kind of where you put the weight. So if you think about here, the biceps, obviously our weight is going to be near the end, where our hand is. And kind of the effort is the muscle that's going to move it, the one that's going to do the effort. So the muscle here kind of attaches the scapula here to the radius on the bottom to lift whatever we have in our hands, right? Probably a dumbbell. I need to work out more. Anyways, so here's our three types: first class lever, second class lever, and third class lever. So you see first class, the effort. So we got our muscle in the back, near the neck, back in the neck, which we'll get into, identifying specific muscles, but that's the one that's going to put the effort. So when it contracts, we're going to be able to move our head, whatever weight we have, okay? So pointing between attachment, we got the fulcrum right here between that muscle and the weight. Okay, so there's only so much we can lift. Then we have the second class, where the fulcrum is like all the way at the end. Our weight is kind of in the middle, and then our effort is going to be in the back. So kind of construction work right here. This is why it has one wheel on the front. You lift it up, and you're able to carry that load or that weight. And you have this little pivot point. And the third class will be over here, where we have our biceps, the one we talked about. Moving the forearm and lifting a weight, where we have our weight at the end of it. Okay, so just kind of knowing different types. So if it's further away, it takes a longer effort kind of to move. If it's closer, it takes less effort. So that's just kind of what it's talking about. Okay. Now we're gonna get into the muscles. So we have I have a book here on the side, so I don't miss anything as well. But let's see. We have different arrangements of muscles that are gonna help you identify types of muscles as well. Okay. So there's some muscles that are parallel. Okay. So fascicles, a bundle of those muscle fibers. So kind of all these little lines, kind of like spaghetti. Put all the noodles together, get this big fascicle of all those muscle fibers that are attached together. So we can have them parallel, we can have them fusiform or fusiform. Then we have like two tendons, kind of like the bicep. We have two tendons, and you have like in the middle, it's a little bit bigger, smaller. In a circle, in a triangle shape, and then we have pennants, where it's like one or two or many of them. So I don't know if there's there's no pictures of that, but you can find that in your book. But pretty much it gives you kind of the shape of the muscle itself, and the shape is going to help you identify the muscle depending on its function as well. Now, how do they name all of these muscles? So we got different ways to naming them. It's not just random names, so that's good. That it's not just randomly named muscles. Okay, there's a reason why every single muscle is named the way it is. Okay, there's orientation of those. So as we talked about, so say for example, we go back. If it's a little circular, we call that kind of like orbicularis, or kind of going in a circle. So depending on that circle, kind of like our eye, muscle around the eye, orbicularis oculi. So depending on the shape or the pattern of it is going to help us identify the muscle. The size, the shape, and the action can also give a hint to what the muscle is. So for example, the big one, the small one, the long one, the short one, the one that moves it closer, the one that moves it further away. So people got creative in identifying and naming these muscles. So that's going to help out. I think that's going to be our biggest helper, identifying the muscles. And then you have the origin and insertion. So where it is, where it came from, where it's coming from, and where it's attached to. That's also going to help identify. So there's muscles that are named off of bones. Okay, so we'll get to that. But there's different examples. Okay, so for example, I have there's no table here on the PowerPoint, but it's in our book. And I suggest you go through that little. It's table 11.2. Okay. So it's going to have examples of direction. For example, rectus means parallel to the midline. Okay, so like rectus abdominis or rectus femoris. So we have a rectus abdominis in the middle here with our abdomen. Okay, so every time you hear rectus, straight up parallel to the midline, transverse, perpendicular. Okay, so we're saying in the abs, we got transverse abdominis as well, kind of going perpendicular to our midline. Then we have oblique. It's kind of diagonal. Okay, so kind of like at an angle. So we have our obliques on the side as well. External abdominal obliques, kind of coming on the sides. Oh, it's right here. Here it is. There's so many names. It's crazy. So here's on the side. So it's kind of like at an angle to the midline. So that's oblique. So every time you think oblique, think of an angle. Then we have, so that's direction. So it's parallel or not, rectus, transverse, oblique. And then we have the size. So we're going to have maximus, which is the largest, minimus, which is the smallest. So if we go to over here to the back, we got gluteus maximus. So it's like the biggest one in our backside. I'm going to say the butt cheeks, but in our backside. State anatomical language. Gluteus maximus, so that's a big one. Gluteus minimus, so that's going to be like the smaller one in the gluteus. Okay. What else we have? We have longest. So adductor longest. So that's like the longest one. So every time you hear longest, that means the longest one. So most likely there's 2 or 3 or 4. But that's the longest one. Brevis, adductor brevis, that's the shortest one as well. What else do we have? We have latissimus, so that's the widest. So we have latissimus dorsi, and latissimus is going to be the widest one. So here, let's look at the back. If you see our latissimus dorsi, it's like super wide. So that's what it means. Latissimus means widest. Longissimus means the longest. So longest just means long, and longissimus means the longest. Okay, so it's the longest one out of that group, most likely. Okay. What else do we have? We have magnus, which is large. Major, it's a bigger one. Minor is a smaller one. So we have our pectoralis major. We have a pectoralis minor as well. So the bigger one, the smaller one. Vastus means huge. Okay, so that's really vastus lateralis. So you see over here in our leg, vastus lateralis. So it's like the biggest one, or the big one there, the huge one. Okay, so here's our adductor longus. Which we have, so that's based off size, and then we have based off of shape. For example, we're going to talk about deltoid. Deltoid is like triangular, so it means triangle. Trapezius, kind of like trapezoid. We have serratus, that's kind of like a seesaw. That you can see here. I think it's here. Yeah, it's right here. So you can see here on the side, serratus anterior. So you're gonna see here, it kind of has this like wiggle lines, kind of like a seesaw. Rhomboid major, orbicularis. That's circular, like the eye that we have up here. Pectinate, or the pectineus, kind of like comb-like. Then we have piriformis, which is pear-shaped. We have platus, which is flat. Quadratus, which is square, or four-sided, like quadratus femoris. We have a rectus femoris as well in there. Gracilis is slender, and then so that's kind of like shape. And then we have action. So depending on their action, also we're gonna have a name. So for example, flexor decreases the angle. So a flexor carpi radialis. So it's gonna decrease that area. So you can see over here on the right. Flexor carpi radialis. So every time we flex that, it's going to decrease that little angle in us. Extensor is going to increase extensor carpi ulnaris. So it's going to increase that angle. We have abductor and adductor. So adductor moves it closer to the midline. Abductor away from the midline. So like adductor longus over here in the leg. It's going to move it closer once you contract it. Levator will raise it up. Depressor will lower it down. Supinator will turn it up. Pronator will turn it down. Sphincter will decrease the size of an opening. Tensor will make it tense. Rotator will make it rotate along its axis. So also depending on its function, you're gonna have you can think a little bit about what the muscle is gonna do. It's gonna help you identify the muscle. And then we have the number of them. So biceps has 2, triceps has 3, quadriceps has 4. Okay, so that's easy to remember. Our bicep and our tricep. Okay, so let's get into, we'll start with the muscles of the head, and then we'll work throughout our body. Okay, so go through my books. I don't want to miss anything as well. Okay, so we're going to talk about the muscles that are involved in facial expressions and how they move to different areas and why they're named the way they're named. The muscles involved move the skin rather than a joint. So instead of moving like another bone and moving it to another place, or kind of like a bicep where it's going to move kind of our radius and our own, like moving up, these are going to move kind of like skin. So when we smile, it's more like moving the skin, not really the bone itself. Okay. So here's our muscles of the head. And I have a list here. Maybe I can go through them a little bit. But okay, we have the occipital frontalis. So that's a cool name. If you split it in two, remember our skull or our bones, the frontal and the occipital in the back. So the occipital frontalis attaches to both. Makes sense, right? We have what's called in the middle an epicranial aponeurosis. So it's kind of like this little tendon that's going to attach the frontalis with the occipital part of that muscle. And you're going to have the whole occipital frontalis. Okay. You have the temporalis. It's going to be on the side. The orbicularis oculi, so the circle muscles around our eyes. What is that? The zygomaticus major. So we're gonna attach zygomatic bone. Here's a major one on the bottom. Here's a minor one closer to the top. So they're gonna move. I'll make a lot of facial expressions so you see my muscles. So every time instead of saying, "Oh, you have a nice smile," then you can say, "Oh my gosh, your levator anguli, levator labii superioris is pretty nice." I'm kidding. Anyways, no joke. We got zygomaticus major, zygomaticus minor, levator. So this one up here, labii superioris. So on top of the lips, levator will raise them up, right? That's what levator means. Levator, labii lips, superioris on top. We have depressor labii inferioris, so on the bottom. Depressor, instead of moving it up, it's going to move it down. The lips and inferior on the bottom of it. See how these words kind of make sense? So don't just memorize them. Try to think a little bit about the name, and I feel like it's going to help you a little more. It's going to help you memorize these a lot easier than just A, B, C, D, E, F, G, or what the names they are. They do have a purpose as to, or a reason why they have those names. What else do we have? Buccinator. Where is it at? I think we have a buccinator in here. Yes, it is. So here we got it near our mouth. So it's going to help us move our maxillary mandible. Okay. We have the risorius. Draws the angle of the mouth laterally. So here's our risorius, la risa. So move it laterally. There's my risorius at work. I get this mustache out of the way so you can see. Oh, that's right. Anyways, it's covering my muscles. Platysma. It's gonna help with the mandible. It's gonna attach to the mandible. So we have here our platysma, kind of here on the bottom. Platysma is coming down, and it's also gonna attach to our deltoids and our pectoralis major muscles on the bottom. Our mandible. That's what. Ooh, look at that. See my muscles moving. Okay, so we got our platysma here on the bottom, connecting to our mandible as well. So the orbicularis oculi is also around the eyes. Corrugator supercilii. That's like the skin of our eyebrows. So here on the top, it's gonna help our little eyebrows. Okay, the occipital frontalis is the one that's gonna help us kind of if you're single, kind of look at a girl. I'm moving my occipital frontalis. Who's that lady? Anyways. Just trying to make it fun, interactive. All right. So here we continue from the side as well. All these muscles. The masseter here on the side. Masseter is like our chewing one, the one that helps us chew. Move everything there. That's like a big one, right? Don't you get tired, or even when you laugh, the muscles get all tired, or we're eating, the muscles get all tired. So we got muscles there. So you can work them out. That's what I'm telling my wife. Stop eating. I'm working out my masseter. I'm working out my different muscles around the body so I can have complete and well-produced facial expressions instead of saying I'm just eating and eating. Anyways. Okay, so we got little muscles that are going to move the eyeballs and the upper eyelids. Okay, superior rectus, so superior, inferior, lateral, medial, superior oblique, it's at an angle, inferior oblique, levator, palpebrae superiosis. So, here we are. So we got our superior oblique on top, levator, palpebrae superioris. So remember, levator is going to move it up. Superior rectus, right? Rectus one, the medial rectus, so more near the middle. Superior more near the top. Lateral rectus, the one that's on the side. Inferior rectus, the one that's on the bottom. And inferior oblique, kind of here coming at an angle. Okay? So they're going to help us move our eyeballs and upper eyelids. It'll help you flinch. Okay, so we got, I feel like that image, those make sense, right? If you think about elevator, moves it up. You're gonna have medial near the middle one, lateral, the one that's on the side, inferior, the one on the bottom, superior, the one that's on top. So, nice. Okay. What else? We have our muscles that move the mandible and help in chewing. So like I said, the masseter, that's our biggest one. Let's see, we got some pictures here. Okay, cool. Here's our temporalis. So it's going to be on the side again in our frontal, parietal, temporal, occipital. So if you think of the bones, you're going to remember that muscle as well. We have the medial pterygoid and the lateral pterygoid. So the medial pterygoid is going to help move the mandible, and then the lateral, it's going to depress it, like you open a mouth and move side to side, up and down, side to side. Okay, so here we have our laterals, and here we have our medial on the bottom, up and down, side to side. Okay. Let's see. Then we also have the genioglossus, as you can see here on the bottom, kind of near the bottom, the mandible. So it's going to help depress the tongue. So it's going to help us in chewing. So depress the tongue. The styloglossus is going to elevate the tongue, help us raise the tongue. So here's the one near the back. Okay, this is going to help us elevate the tongue. The hyoglossus, it's going to help us depress the tongue and move it to the side. And then the palatoglossus is going to help us elevate the posterior portion of the tongue as well. Okay. The palate kind of move to the top. Genioglossus, palatoglossus, styloglossus, and hyoglossus. That's one I was missing, which is back here. Okay. So it's our four that's going to help with the movements of the tongue, kind of moving around. Muscles of the interior of the neck that help with deglutition, so kind of passing the stuff down to our stomach. Okay, the gastric, so it's gonna elevate. So here's our little hyoid bone in the middle. Okay, so our digastric, so it has an anterior belly and a posterior belly, so it's gonna help move that hyoid bone. See how it elevated there? Kind of move to the top. The gastric, the stylohyoid will also elevate the hyoid bone and draw it posteriorly. So here's our stylohyoid as well. So kind of attached to our hyoid bone. Stylohyoid attached to the hyoid. All right, we have our mylohyoid there. It's going to also help move that up and depress the mandible a little bit. Geniohyoid. It's going to have similar function as well. So we're on there, and then we have omohyoid. So that's going to depress it. So now we're going to get to the bottom a little bit. So omohyoid is going to, if we move it up, we need something to bring it down, right? And it's going to come down again. So the omohyoid is going to bring it down. The sternohyoid, it's going to depress it. Where do you think it's going to attach? The sternohyoid. It's going to attach from here. It's going to come to our sternum. Sternohyoid, sternothyroid. So that one's gonna attach to the thyroid cartilage, which we haven't gotten to any of that yet, but we will eventually. So sternothyroid on the bottom, right here. Here's our little thyroid cartilage in our larynx, so it's gonna attach to that, and the thyrohyoid, kind of more on top of it. It's gonna help elevate that cartilage. Okay, so the one on top will help move up. The one on the bottom will help move down. Okay, so here's another picture of them. The sternohyoid, see on the bottom, it's going to attach to the bottom. Sternothyroid attaches. So the sternothyroid, which starts to the thyroid, the sternohyoid will attach all the way to the top to the hyoid, right? So don't get those mixed up. The thyrohyoid also attached to the two, thyro and hyoid, right in between the two, attach those two. Okay. What else do we have? Muscles of the larynx that help us with talking, like what I'm doing right now. So we got the cricothyroid. So it's gonna elongate and place some tension on those vocal cords. Here's our little cricothyroid. No, I don't know. I'm not even gonna try to sing. Okay, so I can't sing. I can play the guitar and the piano, but I can't sing. Only when no one's singing. Anyways, thyroarytenoid. Okay, it's gonna shorten and relax those vocals as well. Thyroarytenoid right here, kind of in the middle. Here's our lateral cricoarytenoid right here, and then our posterior cricoarytenoid. So all of those are going to help move the vocal folds to a different way. What else do we have? The transverse, I believe, arytenoid as well. Transverse cross, remember. The oblique, at an angle, right? Oblique arytenoid. So here's our two arytenoids. Oblique is going to be more of at an angle. The transverse is going to be more across, right? Let's see. Then we have also, so a little bit more about those muscles are going to help with passing down stuff and it's going to help with talking. So we're going to have our superior, so on top, pharyngeal, our pharynx constrictor. So it's going to contract it. So our superior one, pharyngeal constrictor, so we contract that. We have our inferior pharyngeal constrictor as well. We have our middle pharyngeal constrictors, so similar function, one's on top, one's on the bottom, one's in the middle. We have the stylopharyngeus as well, kind of in the back of them. Okay. So they most of them have the same function: elevate the larynx and pharynx, kind of constrict. So the constrictors will constrict those portions to propel the food to come down into the esophagus. That's kind of like the function. But we have the stylopharyngeus, the salpingopharyngeus, and the palatopharyngeus, which I think are going to be here. So salpingopharyngeus, palatopharyngeus, stylopharyngeus. So they're going to help and elevate the larynx and pharynx. Woo! And pass it down. Pass our food down. Okay. All right. So muscles of the neck. Okay. So we have. So here's where we're gonna get to more muscles that you may be more familiar with. We have our sternocleidomastoid. So the sternal head, or the maneuver of the sternum, to the medial third of the clavicle. Okay. So it's gonna kind of come across. So sternocleidomastoid. So kind of here attaches to kind of the top near our occipital region. And it's going to come down to the sternum. Okay. Semispinalis capitis. So that's on the top. Spinalis capitis right here. Splenius capitis right here. Longissimus, the longest capitis. Did you see that? How they were using that? So we have our, let's see, sternocleidomastoid is going to help us with our vertebral column. Again, look at those charts. I have them right here on my book on the side on my iPad, and they have good little charts that have the muscle, that kind of where it attaches to, and kind of their function a little bit, and it's going to help you understand it a little more. Not only so as you're going through this, I'll suggest as you're practicing or looking at images, look at that little chart when you go section by section. Like, oh, that's what it's doing. Oh, that's what it's doing. Okay. So for example, sternocleidomastoid is going to help us elevate our sternum to inhale forcefully. See that muscle? It's working there. It's increasing our sternum, our chest, and everything to help us inhale forcefully. The semispinalis capitis is going to help extend our head. The splenius capitis is going to help rotate the head as well. Same side as the contracting muscle. The longissimus capitis also. They're all going to work together to kind of move our head, kind of flex the way our contracting muscle is moving as well. And our spinalis capitis will extend our head. So maybe like you feel that stretch in the back. Okay, for those muscles in the back of your neck. So maybe you can give your wife or your boyfriend or girlfriend a good massage and their sternocleidomastoid and get into those capitis in the back and semi-spinalis. I'm gonna tell my wife for that when she gets here. She's working right now. You can practice those muscles as well by giving a little massage. Okay. So these are sternal, the biggest one. See how it's attached to both parts. Sternocleidomastoid right here. Pretty cool. Our trapezius in the back, which we'll get to in a bit. Omohyoid, remember it's attached to our hyoid bone, muscle right here, coming to the bottom as well. Okay. So muscles that will help move the vertebrae. Okay, so here's our muscles that are going to help us move the vertebrae. All right, so we have the splenius capitis and the splenius coli. So they're gonna help. They're gonna help extend the head. They'll work together, extend the vertebral column, kind of like extend it completely, move it up or down. So here's our spinalis capitis, splenius capitis, right here, coming kind of like at an angle a little bit, and the splenius coli. So those are the biggest ones right there that are gonna help attach our vertebrae and kind of contract it. Sorry. The iliocostalis coli, those are going to be attached to our transverse processes, so like C4s and C6, and they're going to help. Flex that vertebral column as well. So you got different attachments. So you got the iliocostalis, so costalis or costal ribs. So you're going to attach to the ribs as well. So think about that. Iliocostalis thoracis. So we got ribs 1 through 6. Where it's going to attach to. You can see my cursor to the top ones. Iliocostalis lumborum, so the more the bottom ribs, right? Iliocostalis coli, more of the C4 or C6, more kind of on the top of the vertebrae, a little more. So kind of they go like in order, okay? So coli, thoracis, and lumborum. So kind of C, T, and L. So I remember cervical, thoracic, lumbar. Okay, so those are our 3. We have our longissimus capitis. What does that mean? That means it's our longest capitis that we have. Longissimus capitis coming down. Our longissimus coli. That's the longest coli also coming down. So here's our longissimus coli coming down to near the neck. So our vertebrae. C2 to C6. And then we have our longissimus thoracis. So that's the longest one near our thoracic. Right? Here in the middle, near our thorax. In the middle almost. Then we have our spinalis group. So the spinalis capitis, spinalis coli, spinalis thoracis. Okay? It will help extend the head. They will help also extend the vertebrae to different areas. So just think of like any motion we do will move our vertebrae to different parts of the body. So that's kind of what those muscles are going to do. Depending how you move your vertebrae, where you move your vertebrae to, is what muscle is actually going to be working to move that part. Okay. We also have the transverse spinalis. Okay. We have, so those are more like transverse. We have the semi-spinalis capitis. So here on the top. Semi-spinalis coli. We have it right here. Then we have multifidus. So it attaches to the spinous process and the vertebrae. And we have our rotatories, which is going to help us rotate our vertebrae where it's at. Right. Rotatory here near the bottom. It's going to help us rotate it. That muscle is going to help us rotate right there. And then we have our interspinalis, or between spine, interspinalis, We're gonna have our transversalis, so transverse across, inter between, right? We have the scalenus anterior, scalenus medius, scalenus posterior as well. So here we have our scalenus anterior, posterior, and medius, right? The 1, 2, and 3. So C3, C4, C5. So the little muscles attached to C's with our rib. Rib number 1. So posterior, medius, anterior. Okay. Here's our interspinalis in between a vertebrae. Rotator, the one that's going to help us rotate. Two guys kind of like curved around to help us rotate. And intertransversary as well. Okay. Muscles of the abdomen. So let's do this. Where we at? Muscles of the abdomen that are going to help us move the vertebral column as well. We have our rectus abdominis right here on the bottom. So you can see. So it's kind of like a transverse section. So it's kind of like slit through, and that's near the front. So we see here like our. My picture would probably have a lot more of this little yellow, little belly there. But here's our muscles kind of coming. So think of those muscles either moving down or kind of at an angle. Okay. Here's our rectus to the midline abdominis. Transverse coming across. Internal oblique, external oblique, the inside, the outside, obliques at an angle in the abdomen. Okay. So here's our muscles also that are going to help us protect those areas. So here it is. So here's our rectus abdominis. Here, external oblique near the outside. If you remove that first layer, you're going to see your internal oblique. It's kind of in there. Transverse abdominis is going to come transverse angle. There's our rectus abdominis. Open the external oblique as well on the side. Okay, so think of those names. Rectus, external is outside, internal is going to be inside, oblique is at an angle, transverse is going to be like cut, transverse cut. So you can remember those muscles there in our abdomen. Okay. Okay. Muscles of the abdomen that will help protect our viscera and move the vertebral column. So also we got the external abdominal oblique muscles and the tendons, internal abdominal oblique. So it's kind of like the outside wall, the inside wall, the sternum right here. Okay, so let's look at the muscles themselves. So kind of helping out in breathing. We have our diaphragm. It's kind of right here in the middle. It's going to help us contract it, find increase thoracic activity, inhale, relax the diaphragm. The external intercostals, what do you think those are going to be? Near the outside of the ribs, right? The internal intercostals are going to be kind of like the inside of the ribs. Okay, so external, internal. And the innermost intercostals probably are going to be on the innermost or the inside of those ribs, right? So again, those words are going to help you identify a little bit near the ribs. So costals means ribs. Okay. So here's again another transverse, just cutting across. Here's our vena cavas, aorta, central tendons. Here's our external intercostal, internal intercostal, innermost intercostal. Okay. So we got muscles of the pelvic floor. That's going to help us also with the sphincter, is the viscera. So here's a inferior superficial view of a female. So here's so as you can see in the middle. So you can get a context of this. Here's the vagina. Here's the anus. We have the external urethral sphincter, the compressor urethrae. Help us compress. Sphincter urethrovaginalis, so near our vagina. The bulbosponginosus, so it's kind of right here at an angle. The cavernosus as well, the ischium, levator ani, puborectalis, pubococcygeus, iliococcygeus. Okay, so different muscles that have different functions are going to help with those sphincters for kind of contracting, relaxing, kind of compressing the sphincters and kind of decrease that opening. Right? Okay, we got the muscles of the thorax that will move our chest riddles. So again, if you remember, serratus. So it's kind of like the seesaw. It's right here on the right, like a seesaw. Serratus anterior. We have our superficial. Let me see if it's in this picture or on this picture. Okay. Where am I at? Sorry, let's pass this one. Yes. So we have our serratus anterior. It's going to help with our chest. Abducts the scapula and rotates it upward. So it's going to help us. Scapula, it's going to move it upward. Kind of those. Move it to the top. The pectoralis minor, and the serratus anterior, and the subclavius. Okay, so subclavius, probably what under the clavicle. Subclavius, pectoralis minor, so the smaller one in our chest. Okay, and then we go to the back. We have our trapezius, kind of here. Trapezoid, our trapezius, superior middle fibers. Rhomboid minor, rhomboid major. It looks like a rhomboid if you look at this shape. I remember this in like elementary school. You know, you have little shapes. I never knew what that shape was called because I didn't speak English. I don't know how to say it in English. Okay, we have our trapezius kind of over here near the back, all the way across, and the serratus anterior over here. Okay, so it's gonna help elevate, depress, abduct. Rotated, upward, downward, wherever we need to move that chest. Let's see. Muscles that help move the humerus. So funny, so funny. We have here's our pectoralis major. Okay, then once you cut through that, we're gonna see our pectoralis minor in there, but mainly our pectoralis major, subscapularis, right under the scapula. Coracobrachialis, pectoralis major, the teres major, the deltoid on the top and the back. Okay, in the interior it's our acromion, clavicles. We have our deltoid right there, on the outside. What else do we have? So we go to the back. So we're looking at the back. Here's our teres major. These are triceps come here on the arm. Infraspinatus, supraspinatus. So supra goes on top, infra will be on the bottom. Rhomboid again. Teres minor, you see it's kind of like a cross, it's a little one, and the major is a bigger one. Here's our deltoid coming through the back across. Again, our major, teres major. Coracobrachialis near the front. And our latissimus dorsi. Here we have scapula and clavicle, supraspinatus, and subscapularis, infraspinatus, supraspinatus. Okay, our triceps, our biceps. Again, so they're going to help move the radius of the ulna, obviously move our arm. So see how like, well, I guess those don't have names, kind of like the bones, but a lot more will do. So by recognizing the different bones up here, or clavicle, or scapula, subscapularis, you know it's in the scapula. So if you just get a random name like that, you find the bone and you'll find the muscle. Okay. Let's go to, okay, so here's muscles that help move the radius and the ulna as well. We have our triceps. So here's kind of like, again, a transverse here of our arm. Here's our humerus in the middle. Our brachialis, triceps, brachii, so in the back, our triceps. the long head, the medial head, the lateral head, so the one that's on the outside, the longer one, and the one that's in the middle. And we have our biceps, right? Short head, long head, and our brachialis right here. Okay. So here's our brachialis, brachioradialis, that's a radius. Pronator teres is going to help us pronate. Pronator quadratus near our hand, near our wrist. Anconius supinator to help move it up. Okay. So now muscles of our forearm, that's going to help move our wrist, our hand, our digits. Our supinator, we got our flexor digitorum, flexor pollicis longus, the long one, pronator quadratus. So here it's kind of like at an angle near our wrist, getting close to our wrist. Okay. Pronator teres, kind of like in our back, we have our teres major, teres minor. Okay, our brachioradialis right here. Our flexor carpi radialis, so we're gonna flex. Flexor carpi ulnaris, radius or ulna. Okay. Extensor carpi, so it's gonna help us extend. So we do like this, so I feel that. I feel this stretching right here. We have our external carpi ulnaris, external digitorum, external carpi radialis. Let me see. So these are all going to help and move the wrist, kind of move our fingers a little bit, our forearm, our digits. Depending which finger you move, you're going to move a different muscle around our forearm, right? Abductor longus, extensor longus, extensor indicis. All right, so we got, when you move the thumb, it's pretty cool how our thumb's like completely different from the other fingers. That's pretty cool. But so when talking about or looking at the thumb, so we got flexion, extension, we got abduction, adduction, move it out, and opposition, move it across. Okay, so each one is going to have a different muscle that's going to help us either flex or extend or adduct or abduct, move it to the side. Okay. So you can see the abductor brevis, the flexor pollicis, the adductor right here on the bottom, right? Adductor digiti, flexor digiti, lumbricalis. So we got here first lumbrical, second lumbrical, so moving the middle one, but here's our attachments to our thumb. So we're gonna abduct, you got your abductor pollicis brevis, we're gonna flex it, move it to the side. Right, flexor pollicis brevis. All right, muscles of the gluteal region. Okay, so we have our biggest ones, right? The gluteus maximus, gluteus medius. Okay, our psoas major, psoas minor coming at the top. Iliacus, attached to the ilium. Tensor fasciae latae on the lateral side. Okay, here's our gluteus minimus. So here's our maximus. Once you cut it out, you can see the inside. We have our minimus on the inside as well. Piriformis right here. Here's our greater trochanter in our femur bone. You can see, so they're all attaching to there. Most of them are attaching to there. Their inferior gemellus, the quadratus femoris, right in our femur bone. Quadratus femoris. Gluteus maximus again wraps kind of over all those. Obturator internus, and like in the inside as well. Okay. What else do we have? Muscles that are gonna get into the femur, the tibia, and the fibula. So kind of getting down to the leg now. So here's one. Okay, so I kind of skipped ahead a little bit. So we have our femoral triangle. We're going to have our iliacus right here. So here's our sacrum. Think about our vertebrae here. The sartorius kind of coming across, right? Sartorius. Our quadriceps, femoris, kind of coming to the top. Rectus femoris, our vastus intermedius, vastus lateralis on the side, rectus, femoris, through the midline, right? Parallel to the midline. Vastus medialis, so like the big medialis bone right here, vastus medialis. Again, here's our adductor magnus, adductor longus. So it's gonna adduct the bigger one, the longer one. What else do we have? The pectineus, vastus lateralis on the side as well. The sartorius coming across. Okay. The gracilis here, kind of like on the inside. Here's sartorius again. Semimembranosus. Here's our hamstring. We got the semitendinosus and semimembranosus. That's what we have. So here's a transverse section again of all the muscles kind of coming across the rectus femoris over the top and the outside. Sartorius. Here we got vastus medialis, vastus intermedius in the middle, lateralis kind of on the sides. Okay. So it's individually almost like every muscle, the vastus medialis, intermediate with the sartorius coming across, lateralis, rectus femoris, adductor longus, gracilis. Okay, so kind of check around those images, look around the legs, kind of try to identify the different muscles and their functions and where they go, what they do, how they move, things like that. And then we have our muscles of the leg and move the toes. Famous one, the gastrocnemius, right? We have our tibialis anterior, so in the front. All right, so we see our fibula, our tibia. So we have our tibialis anterior, fibularis longus, so the long one connecting to our fibula, extensor digitorum longus, so the long one connecting to our digits. The bottom is going to extend them. The flexor digitorum long one is going to flex them. Fibularis brevis, tertius, hallucis longus. We have our extensor digitorum. So here's through the back. Here's our gastrocnemius again. Plantaris kind of coming in between them. The soleus near the back, near the bottom, near our soles. What else do we have? Flexor digitorum longus kind of coming down. Fibularis brevis. So here's individually. Here's our brevis in the back. Our longus, the longer one. The extensor digitorum long one that extends our digits. Fibularis rectus, kind of like in the middle of them. Tibialis anterior, right? Gastrocnemius, soleus, tibialis posterior, longus. And we have our intrinsic muscles of the foot and the toe. So we have here our adductor hallucis, lumbricalis, again, kind of like in our hand as well. Most of the digits, but then we have the ones that are basically in our thumb, on our foot. The plantar, the flexor, the flexor hallucis brevis. I'm going to kind of move that a little more. Flexor digiti minimi brevis, a little one here on the left, near our pinky. Abductor digiti. Quadratus plantae near the bottom. Okay. And the plantar interossei, so in between the bones. And the dorsal interossei, also between the bones. Okay, so that was it. Again, I know, I feel like a lot of this, you just go through the images, go through the lab. There's some cool with real anatomy, some images, try to play around with anatomy drill practice, kind of move the labels, move them around to the different muscles, and spend as much time as you can trying to memorize a lot of these muscles. Okay, they're for your own benefit, for later on, for your career. So try to memorize many of these muscles. And this is just anatomy; it's just the structure of them. in physiology, or when you take physiology, then we'll get more into how they work, why they work, what they do, how they do it. So, but you need to know them before you know what they do. So, so yeah, I'll see you in class.